Uh-huh. So do you want to get into the questions?
Yes, let's move on, surely.
Okay. So before we get to the audience questions, what do you think is like the ultimate trick to kidney health, like the code to crack it all, you know?
Okay, and that's a somewhat of a difficult question because kidney disease is actually multifactorial, and a lot of times I tell my patients, hey, it's usually a secondary cause. Commonly, we think about risk factors like diabetes and blood pressure, and use of certain medications. Obviously, weight's a factor. Sometimes you get this thing called FSGS, or where being overweight can put stress on the kidneys. So there's a lot that actually plays a role in developing kidney disease. The other thing is there's definitely a genetic component as well. So we really have to, I think my message would be staying focused, staying healthy is going to be key. What we need to do is mitigate the risk factors such as diabetes. If we have diabetes, we have to make sure that that is well controlled. If we have any kind of blood pressure issues, because that's another risk factor for having kidney disease, it's of utmost importance that we're monitoring your blood pressures, doing things to maintain that in a good level. Um, Food is very important as well. Again, it's different here in the United States versus back home. But again, we have to look at the types of foods that we're eating. Typically, we would say, focus on a plant-based diet would be most optimal for kidney health. But again, I guess what I'm trying to say is, from a kidneys perspective, it's kind of focusing on overall health. The more we're doing to improve cardiac heart function, staying heart healthy, making sure liver is doing well, it goes along with improving kidney health as well. So, in summary, I would say making sure your weight's controlled, making sure your diabetes, if you have diabetes, is well controlled. If you have blood pressure, making sure blood pressure is controlled. Uh, Staying away from certain medications. So we get certain medications like the NSAIDs, like
Mm.
ibuprofen, Motrin. These are medications that we typically use, and sometimes we use it very often, and that actually can lead to some kidney disease. So, kind of limiting the use of that can also help. And make sure you're staying hydrated. These are all things that we can do to protect kidneys.
Follow up to what you just said. What NSAID do you think is like the must avoid, like something that you find your patients abuse a lot?
Well, and again, it could be due to the lack of knowledge because, here in the States where we practice, you buy things like Motrin, Aleve, ibuprofen, these are all over-the-counter non-steroidal medications. And again, we get this at home back in India as well. You can go to the pharmacy, they'll say, hey, I have joint pains. Okay, take this. So, we typically, in general, the thought is you don't want to overdo it on any of these non-steroidals. So there's not one versus the other. The concept should be you want to limit it. You don't want to take these medications just like candy. Um, if we have any kind of kidney problems, I typically advise, I would probably use Tylenol or acetaminophen or paracetamol for joint pains and fevers here and there. Again, overuse of that can lead to liver disease and stuff too. Um, Now, let's say we have someone who has absolutely normal kidney function. And is it wrong to use one of these medications here and there? Probably not. I mean, it's okay to use this very seldom, but when we get into the habit of using this on a daily basis, that's when we start getting into trouble with the kidneys.
Mhm. Thank you so much. I think that's wonderful advice. So I think we should chalk that up to a good diet and exercise, and maybe not abusing the NSAIDs.
I think that's a start for sure.
Uh huh.